Hi, my name is Nick Francis and I'm the lead author of the paper on the management of acne vulgaris in primary care. Many patients with acne manage it themselves, they don't consult with healthcare professionals at all, but when they do consult, it's most commonly with primary care clinicians. However, we don't really know much about what happens with the primary care management. We don't know how often patients consult, how often they're followed up, and what the management of these patients is. So in this study, we used routine clinical data, which found in the Clinical Practice Research Datalink, or CPRD. This uses data that's recorded by primary care clinicians. We identified acne consultations by searching for recodes for acne vulgaris. We also identified consultations where there had been no previous acne consultations or prescriptions for acne medications in the year prior to that. We were interested in describing trends in acne consultations, so we looked at data over a 10-year period from 2004 to 2013. We included just under 320,000 patients and had just over 716,000 consultations. This figure shows consultation rates and shows that the highest consultation rates are in teenage girls, followed by teenage boys, and then in young women aged 19 to 29. In terms of follow-up consultation, we found that 2/3 of these patients had no follow-up consultations in the year following their initial consultation. In terms of medications, oxytetracycline was the most commonly prescribed oral antibiotic in 2004, but limacycline prescribing increased over this time period and became the most common agent prescribed from 2008 on. In terms of topical agents, it was clindamycin that was the most commonly prescribed. And over the time period, the combination of clindamycin with benzoyl peroxide increased and became the most common from 2008 on. During the new acne consultations that we identified, 3/4 of them involved a prescription of some sort of acne-related medication, and 1/4 didn't. Of those who were prescribed something, about 1/3 received oral antibiotics, which was the most commonly prescribed agent at a new consultation. In the subsequent 90 days, 2/3 of patients received no follow-up acne medications at all. There are two key messages that I'd like to highlight. The first is that many patients who are having a new acne consultation are not having follow-up consultations and often not being prescribed any further medication. Now, it's possible that some of these patients are happy to self-manage and use over-the-counter medications, and some of them may have been referred on to secondary care. But we still believe that this points to a potential concern. The second issue is that the most commonly prescribed acne medication, certainly during the initial consultation, is oral antibiotics, and the majority of these patients are being prescribed oral antibiotics without any topical agents, and is potentially a concern in terms of the development of antimicrobial resistance. So I hope this paper has been helpful for you, and thank you for watching.